Welcome back, everyone. Sorry about the technical difficulties with ARMT. They will be joining us again in 2 weeks. But let's introduce our next presenter. We have Hemostemix. It trades on the OTCQB under the symbol HMTXF and on the TSX under the symbol HEM. Founded in 2003, Hemostemix is an autologous stem cell therapy company and a winner of the World Economic Forum Technology Pioneer Award. The company developed and has published 7 peer-reviewed articles about the safety and efficacy of its lead product, ACP01, as a treatment of CLI, PAD, angina, ischemic cardiomyopathy, dilated cardiomyopathy, and other conditions of ischemia. Please welcome its co-founder, president, and CEO, Thomas Smeenk. Welcome back, Thomas. How you doing?
I'm very well, Anna. Thank you. How are you?
Great. That was a mouthful. I hope I pronounced everything correctly.
You did great. That was, great. Yes, very well done.
Fascinating stuff. So we look forward to hearing your presentation. Take it away.
Sure. Thank you. So we announced today that Dr. Ciceri and Dr. Giannetti have joined the management team as co-chief medical officers, effectively responsible for guiding the company through our phase 2 clinical trial, which will soon be announced. This is the chief of cardiology at McGill and chief of heart transplant medicine at McGill. And both have done due diligence on Hemostemix, on ACP01, and as stated in the press release, they are convinced that ACP01 will be the first to patient approved autologous stem cell therapy for heart disease. That's a significant statement, and is one of the reasons why I think you should join management in investing in our company. So to go into the presentation, I want to give a little bit of background that, there are really 2 forms of stem cells. There are stem cells that come from your own body. Those are autologous. And there's stem cells that come from a donor's body. Those are allogeneic. Obviously, the stem cells that come from your own body are your DNA. They have your hardware and software built into them, so they're intelligent. They recognize the body's natural signaling processes, and they leverage those signaling processes to home to the site of need, to embed at the site of need, and to create, in our case, create new blood flow where the body is signaling it needs new blood flow. And so that's the technical side of what it is. I'll show you here, and why we're so excited about Hemostemix. I will make forward-looking information statements to give you an appreciation for where we're at, where we're going in terms of not only the clinical development of the company, but also the business development. So you have a sense of our build-out. Our vision is that Hemostemix can be the first and most affordable autologous stem cell therapy company that will treat heart disease. This is often called cardiomyopathy. You'll also hear it expressed as angina. Our mission is to really to scale this process and to make it affordable. We believe that there's a real market opportunity when we do so. The market sizes for these indications are significant. They're multi-billion-dollar market opportunities. Any one of these market opportunities would be a company maker. The fact that Hemostemix has treated angina and published on it, peripheral arterial disease and critical limb ischemia and published on it, ischemic cardiomyopathy and published on it, you should give you a sense that this works, and it de-risks, to a large extent, de-risks the company going forward. We are just in the middle of reviewing now some 50 consecutive patients who were treated for COPD. So just as we published or are about to publish on the 52 consecutive patients that were treated for ischemic cardiomyopathy and dilated cardiomyopathy, We are now doing a retrospective analysis of another 50 subjects who were treated for COPD. We do have treatments of vascular dementia as well. Mrs. Lamb is a very interesting story, a 79-year-old woman who was being committed to a long-term care facility because she couldn't manage her daily functioning. She had an ACP treatment. I spoke with her this past summer. This is 10 years post her treatment, and she not only is still driving her car, which is not unique for octogenarians in Florida, but she's taking care of herself and taking care of her husband. And she was talking about her social calendar like you and I would talk about our social calendar. So very significant therapeutic here that changes lives. Hemostemix is a platform technology. So properly understood, it's not one indication company. We actually have 3 derivations. ACP has been used to treat some 500 subjects. NCP is a nerve cell precursor that is now in study at Clemson University. CCP is a cardiomyocyte cell precursor, a heart cell precursor that promises to treat heart disease following a heart attack. This is a very scalable process. Essentially, we have a 7-day process, and it's as simple as donating a cup of blood to yourself, shipping that to us. We then create ACP over the period of 5 days, ship it back to your treating physician, who then does a femoral artery approach up into the heart, up into the lungs, or does a injection of ACP into the toes, feet, and legs if you're suffering from ischemic cardiomyopathy. Our clinical trial history is rich and robust and significant. If you look at our results and you read these published results, again, I think it'll give you a sense of the how you have de-risked your investment in biotech. The first study was of critical limb ischemia. 5 of 6 patients saved their limb from amputation, 83%. The second, reading from left to right, the second study is of 20 subjects randomized to receive ACP or a placebo. After 2 years, in the treated arm, 7 of 10 saved their limb from amputation. In the non-treated arm, there were 2 deaths and 6 of 8 lost their limb to amputation. We just completed a 65 subject clinical trial. This is a truncated clinical trial. It was truncated by previous management. It was originally designed and powered to study 95 subjects. And the truncation of the trial has affected the power of the study, meaning that the results are not statistically significant. But what we saw were trends that were in keeping with the previous trends, and that, namely, that there was a reduction in limb amputation, improvement in ulcer healing, and a reduction of pain at 12 months. The first heart study was an angina study of 24 subjects treated for inoperable angina. They had a whole decrease in their angina symptoms. So they went from a class 3-4 to a class 2-3 in terms of their symptoms. That's the equivalent of having chest pain at rest to not having chest pain at rest and only having chest pain during vigorous exercise. They're also able to demonstrate an improvement, a 24% improvement in the distance they could walk in 6 minutes. And they're able to demonstrate increases in their metabolic equivalents and their ability to exercise. And there was an improvement in perfusion defect as well. That was followed by 2 trials, 106 subjects and 141 subjects treated for ischemic and dilated cardiomyopathy. These are the sickest of the sick patients that have exhausted all pharmaceutical, all medical, and all surgical options. And what's so impressive about the results here is that it's the sickest of the sick that actually do the best from ACP, and you'll see that in the following slide and study as well. But we're able to demonstrate essentially a reversal in heart disease. This is demonstrating, both of these studies demonstrated a 4.7 to 4.8% absolute improvement in ejection fraction. That's the equivalent of reversing heart disease. And when you have 2 or 3 additional sicknesses and you're able to have an improvement in your heart functioning, that improves your symptoms in your other conditions as well. And when you read these studies, you'll read about subjects that actually had a comorbidity of diabetes. They were able to reduce the amount of insulin they were taking. And there are many stories here that I can, personal subjects that I met that talked to me about their treatments. I'd be happy to talk to you one-on-one about them. They're no less impressive than Mrs. Lamb's story. We've just completed over the summer, in addition to rescuing the CLI trial, we completed a retrospective study of 52 consecutive patients treated for ischemic and dilated cardiomyopathy. And what you're seeing here, again, is a statistically significant improvement in ejection fraction, in the volume of blood the heart pumps. This is an improvement that is demonstrated over at 4 months and at 12 months. And you'll see here in the lower category, the dilated cardiomyopathy, an improvement, absolute improvement of ejection fraction of 14%. This translates into a statistically significant improvement, obviously, but in range, it's a range of an improvement of, on percent basis, as compared to the ejection fraction volume. It represents a 16 to 55% improvement in percent terms. This is very significant. What's interesting about the dilated cardiomyopathy is a competitor, if you will. Myocardia was bought by Bristol Myers Squibb for $13.1 billion for a treatment called mavacamten, which treats dilated cardiomyopathy and demonstrates to reduce the symptoms of it by one whole classification as measured by the NYHA classification of heart disease. When you read our story, which was in our clinical trial, which was written up by Dr. Kit Aram, a co-founder of the Minnesota Heart Institute, on the 41 subjects that he treated for ischemic and dilated cardiomyopathy, he also demonstrated a whole decrease in the classification of NYHA classification of heart disease. So we're getting similar results to mavacamten. And what's interesting, whereas mavacamten is got a label indication that it should not be used for anyone who has a left ventricular ejection fraction of less than 50%, the ACP01 treats those subjects who have a LVEF of less than 50%. In fact, what you're seeing here is that there's a more significant improvement in the lowest quartile of patients. Those who have an ejection fraction of less than 20% had the greatest improvement in LVEF percent terms. And while each quartile here moved up a category, the fact that we can treat the population base that is less than 50% is very significant. And I think when you do your due diligence, you'll note that that's our market cap as compared to 13 billion is a very significant divergence, and therein lies the opportunity. Key differentiators of ACP are that there is no patient risk. You're using your own stem cells to treat your body. It's a very simple protocol. We've had no reported safety issues. These cells are fresh, so they have a very high cell viability. And as I mentioned, They're your cells, so they leverage the body's natural signaling processes. Because they're your cells, there's no ethical concern with respect to how the cells were sourced. And it is a very scalable process. So we, in the space of 5 days, take your stem cells and create ACP and create a sufficient number of them that your body takes them and leverages them and recruits other stem cells that are circulating in the body to that site of need. That's really how ACP works. And that's why we trademarked your Fountain of Youth, because my vision is that we will, on an annual basis, as we age, we will leverage our body's stem cells to tune ourselves up so that we can maintain a quality of life, well into our 70s and 80s and 90s, if we do so. That leads me to scaling this. We hired Peter Pavlin, who's got a significant career in scaling manufacturing processes. Peter looked at this first in the 2008 timeframe when I was originally running the company as a private company. He's come back, joined our team as of February, and we have not only compared ourselves to the industry, the autologous industry, but we've compared ourselves to the allogeneic industry. And we believe that we can drive the cost down per batch into the $2,500 cost per batch, charge about $7,500 a batch, so that you and me and your loved ones will be happy to go on a payment plan and pay for annual tune-up. And I think in addition to obviously, focusing on the cardiomyopathy market, the angina market, the vascular dementia market, when you look at it in terms of really how healthcare is moving from a reactionary-based system to a proactive-based system, Hemostemix fits right into that precision healthcare where you're understanding your health needs, you're leveraging your stem cells to maintain your body's natural health. Our management and directors are well invested into this company. We have, 35% ownership in the equity, over $8.5 million invested in the company. We're led by Peter Lacey, our chairman, who has built a company. His company he built from one John Deere dealership to 63 John Deere Peterbilt dealerships, doing over $1.2 billion a year in revenue, profitable, obviously. He just recently sold that company. Dr. Ronnie Hirschman invested over $1 million in the company originally when he's a cardiologist based in New York. When he saw the results of ACP in terms of heart disease, he voted with his equity and invested in the company. Dr. Fraser Henderson is our chief medical officer, has also invested in the company. He is also a practicing neurosurgeon and has been instrumental in the creation of NCP, bringing NCP from the bench into an animal study. We also have an advisory board, a business advisory board, which includes Sheila Copps, the former Deputy Prime Minister of Canada, and David Sabushi, the former Solicitor General of Ontario, and Tim Chang, a former Managing Director of Private Equity Investment at Cerebus and AIG in Hong Kong. We've recently announced the additions of Dr. Giannetti and Dr. Ciceri, Dr. Galeri and Dr. von Schwartz, and Dr. Terry Hebert to our scientific advisory board. And as mentioned, Dr. Giannetti and Dr. Ciceri are joining our management team as well. These are esteemed individuals who are stem cell scientists who have done their due diligence and who have concluded and have stated that, in their view, ACP will be the first to patient approved treatment for cardiomyopathy. Again, that represents a significant investment opportunity. We have 74 million shares issued. We have 74 million warrants issued. There's about $35 million embedded in warrant financing in the company. So key takeaways are Hemostemix is a de-risked biotech investment. The market cap is teeny tiny, $12 million. Literally, I think you've got up to a $13 billion walkaway here. It's a highly scalable process. We have multiple indications, any one of which is a company maker. We are going to market in parallel. You'll see news releases in that regard. We've already announced PRESERVE and the creation of an animal study. Our view is that the shareholders in this company deserve a dividend of, for example, of PRESERVE. And so that will enable us to go to market in parallel with NCP. There are few, if any, competing products in the marketplace for the treatment of heart disease. And we have treated over 500 patients with ACP, and we get inquiries daily from individuals who are looking for a treatment of ACP to not only treat their heart disease, but to treat loved ones in the family suffering from vascular dementia. It's a significant opportunity, and I hope you'll join us as a shareholder, as an investor. Thank you very much. With that, Anna, I turn it over to you for questions.
All right. Great job, Thomas. We do have some questions for you. Sean Graves asks, what is proprietary? Is your process patentable?
Yes. We have 91 patents. And what is proprietary is that we proved to the world that there were, number one, a sufficient number of stem cells in your blood. Number two, that we could take those stem cells and create a synergetic cell population. And number three, that we could then derive angiogenic cell precursors, heart cell precursors, and nerve cell precursors from the same source product. And then we also patented the scaling of the manufacturing process.
Great. Veronica Gordon wants you to talk a little bit about the benefits of Dr. Cicere, is that how you say it, and Giannetti, and
Yes.
what they bring to the company, and give us a little timeline of that.
Sure. So they're heart doctors. They deal with thousands of patients suffering from the diseases that ACP treats. They're also stem cell scientists and have been working with allogeneic source stem cells to try and create a product that could help these individuals. So what they bring is advice on the design of our next heart phase 2 clinical trial. They bring the ability to be lead investigators of that clinical trial. They bring an ability to convince investors and institutional investors on the viability of ACP and the veracity of the treatment of cardiomyopathy using these cells. And so I think what you'll see is over the next 6 months, we'll be announcing contract manufacturing. We'll be announcing a phase 2 clinical trial of heart disease, and we'll be announcing the early results as we enroll subjects. Interestingly, when you have a heart center like McGill, which is one of the top 10 in the world, leading a study like this, that the benefit is that it brings other heart centers into the fold very quickly.
Ed asks, is there a timeline to cash flow positive? And how much money do you need to raise over the next 12 months to support the burn?
Sure. So the interesting thing here is that with the phase 2 announced, and given our profile, having treated so many cardiomyopathy and other individuals for these conditions, in the U.S. under the Right to Try legislation, individuals can apply for treatments like this. And so we expect to be in a phase 2 clinical trial over the next 12 months. And we expect to be working with individuals on a one-on-one basis to give them the right to try and get them access to ACP. That won't necessarily generate a positive cash flow in terms of profit, but it will generate it will start to generate cash flow for Hemostemix. And in terms of the amount of raise, we will raise in the order of $5 million to get the phase 2 up and running and address burn.
Great. Corey Becker wants to know, what price are your warrants exercisable at?
They're exercisable predominantly at 55 cents. So while they appear to be out of the money here, I don't think that they will be. I do think that they will be exercised over in the fullness of time.
Kyle C. wants to know, is there an opportunity for a joint venture with a major biotech to fast track your model?
Yes, there is. And we've announced that we have reached out and have a program that is focused on what we'll call the larger companies, Big Brother, if you will, to partner with us on either an indication, likely an indication by indication basis. And yes, that would be viewed initially as non-dilutive funding.
Great. Bob R. says biotechs are at an all-time low due to the potential caps on drug costs and procedures. You know that. So how is this having an effect on your stock appreciating?
It's, I think there's, that's true on an industry-wide basis. I think when you look at Hemostemix and compare it to those other opportunities, biotech investments in the marketplace, I think there's really a divergence, and we've been suffering from a historical situation that is now behind us, and we're rebuilding the company. So I think you really have to look at Hemostemix on a one-off basis.
Marge G wants to know, is all your R&D done in the U.S.? Do you have exposure to other demographics? And if so, can you talk about your exposure in other countries?
Mm-hmm. That's a great question. Our clinical trials have been done in the U.S. The last phase 2 double-blind was done in North America, across North America in 17 centers. We have done a number of other studies, in one study in Hungary, 3 studies in Thailand. So we do have exposure to a global study base. The relationships that come with Dr. Grilleri, for example, at the Boltzmann Institute in Vienna, represent an opportunity to branch out to Europe. We're also looking at contract manufacturing on different continents to enable us to access and create revenue profile and clinical trial sites on other continents other than North America.
Great. How much would you need to raise in order to support the facility build out?
So the facility build out is about $2 million.
Okay. A question, someone's looking to partner for ACP. Could you tell them what the consideration to Hemostemix it would constitute in respects to such a partnership monetarily?
So it really would come down to the indication, and we would look at the market, and we would want to have a discussion with them one-on-one, with respect to milestones that would be met. But if you look at traditional biotech deals in this space, it's not uncommon to see a $50 million type of a license arrangement, followed by up to $250 million in milestone payments that would enable us to partner, or a partner to partner with us.
Got it. Well, Thomas, this is fascinating stuff and important technology. So thank you so much for joining us on our conference, and please come back again soon with some more updates.
Will do. Thanks very much, Anna.
All right. Thank you so much. Okay, everyone, stay with us. We're transitioning to our next presenter. We'll be right back.